As an educator, I have seen the need to have practices implemented within the educational setting, as I've seen in Dr. Dayna's office. And I'd asked her to come into the educational setting and work with some of our students who were having difficulties both academically, socially, and behaviorally. What I had seen is Dr. Dayna had come in and done some in-services for both myself and our staff, and really tried to teach them and apply things from a clinical setting to an educational setting. One, for instance, of this was a student that we had who was diagnosed with autism and Aspergers, and was having a very difficult time adjusting to the academic setting, where she would have consistent meltdowns and not be able to be in the regular educational setting. When Dr. Dayna had come in, she had not only evaluated and through observation, just watching this child and some of the tendencies that she would have, both behaviorally and academically, and tried to help teach the techniques that she would use in a clinical setting and apply them to an educational setting, both to our aides, our staff, and to myself as an educator, to help this child function in a regular education setting. What I've noticed that she does, which is very different from most, is she really taps into, not only the physical aspect of things, but also the behavioral, the emotional, and the mental. She gets her students to listen and attend by not repeating instructions and providing them with a crutch, but rather by holding them accountable for what she's asking them to do. The children then respond to that in kind, and she has different techniques that she uses to do that. But it is amazing to watch the children transform over time to the strategies that she uses and comply and show that they truly can achieve what they and their parents may have thought they cannot. One autistic patient that stands out in my mind is a young lady who is having very hard time complying with instructions, following directions, completing a task, and also keeping herself in check at school as well as in the home environment. She would have consistent meltdowns in many settings, and her parents were very frustrated with this situation and really needed help. Over time, as Dr. Dayna had worked with her and applied her principles of being consistent, being fair, and her keeping her expectations exceedingly high for these students, they did comply with them. She would have them do things where she tapped into multiple modalities. For example, she would have this student who was having trouble following directions and who would get very frustrated when she could not do something, do a physical activity such as using an agility ladder, where she would have to follow patterns. These patterns would help drive the brain. As she did these physical patterns and had to focus on what she was doing at the same time, it caused that link between the mind and the body connection, and which is what that child needed to help her flourish in other activities. The child at first got very frustrated with this because she was not able to do what was being asked at that time. Over time, as Dr. Dayna kept her expectations high and very gently and taking into consideration the child and the nature of autism, had her expectations held high and refused to provide her with a crutch or opt out of the situation. Eventually, that child did push herself through listening to the instructions given and knowing that she was held to those high expectations, was able to do the activity, and from there then progress to the next level. Dr. Dayna is an incredible neurologist. I have seen firsthand her work with both students and children and parents. I've really been impressed with the multidisciplinary approach that she implements, and how well her children and students respond to her.